Welcome to the Back in Action podcast, where you're going to hear from me, a spine physician, Dr. John Lavelle, and two coaches, Dusty Holden and Josh Bunch. We're going to help you rethink pain, rebuild strength, and regain function so you can get back to enjoying the things you love in life without limits.
Welcome to Back in Action, a podcast where we use performance to turn down the volume on pain. With me today, Dr. John Lavelle. Doctor.
All right, just the two of us today.
Yeah,
Dusty's
into
out.
the new year. That's right. It's just you and I talking about the cost of avoidance. Mm-hmm. What goes first when I avoid exercise? Balance, strength, power. What tends to be the thing that'll go extinct first?
First thing you're going to lose is muscle strength, muscle mass, I should say. So that skeletal muscle mass you start to lose. With that comes strength. Okay. So as you lose muscle mass, you lose even more strength with it. You know, they'll say on average after about age 40, and it gets worse with age, you lose up, 1 to 2% of your muscle mass a year, but strength is about 2 times that. So as you're losing that muscle mass, you're losing even more strength. So then you're going to lose balance. You're going to lose functionality. You're just going to be able to you're going to be doing less and less.
I was thinking about this today, that I'm super grateful to be able to ask you questions that maybe a lot of people, for one reason or another, don't have time to ask their doctor. Maybe they've never thought of it. Maybe they've never been in a position of comfort where they could really say things like that. And we always get off on these tangents. So that the one that we got on that is, if I'm losing strength, is that sort of precipice that you were talking about, 1 to 2%, can I halt that with exercise?
100%.
Okay.
Yeah, you can halt the avoidance and start getting moving, and that's going to help.
Does the pain set in because of the loss of strength or because of the loss of muscle mass?
Well, loss of muscle mass.
Okay.
Because loss of muscle mass is what causes the loss of strength, but you won't lose strength per se if you don't lose muscle mass.
Okay, got it.
So as you lose that muscle mass, you're losing stability in all your joints. We talk a lot about spine because that's what I focus on. But as you lose that muscle mass stabilizing the spine, you're going to start to feel the degenerative changes under that. We've talked a lot about how we all degenerate over time in our joints, our discs in our spine. You're going to get that degeneration. It's just part of life. Mm-hmm. Our skin cells, hair, we turn gray, lose our hair. So as our cells die off with age, you're going to get that degenerative process. So if you lose the muscles that are stabilizing that spine and that spine's degenerating underneath, those muscles are what's taking pressure off that spine. And as you lose that muscle mass, you get more pressure on those degenerative areas, the more likely to flare up and feel pain.
Okay. So when you're talking about that, that issue that we're having with degeneration, we don't all experience the symptoms the same way. So even though we all experience degeneration, we might not experience symptoms.
Yeah, 100%. I mean, you and I both have some arthritic change in our body right now, but
doesn't necessarily mean that we feel that.
Yeah, most people don't.
Have you seen in your practice that patients that experience pain are more likely to have not exercised? So is exercise kind of like that chemical soup that makes you not feel it? We've talked about that with the desk worker and stuff like that. The less active you are, the more, what did we say? Up to 94% of people, as you're inactive and not working out, are going to experience some pain. Mm-hmm. Maybe the 94% was with athletes that are overactive. I'd have to look back. Okay. Okay.
Either way, yes. If you're less active, you're going to be experiencing pain.
Is that
now? Athletes will experience it from overuse, but more commonly in my practice, and as we get older, people get less active. They may retire. They feel like they have earned that right to just chill, which is true, but that doesn't mean you sacrifice the physical component, because chilling means I want to go on vacation. I want to hike, some mountains. I want to go to Europe and walk around and see all these cities. Well, you can't do that if you don't have muscle mass, thus muscle strength to be able to do that.
Is this where you'll have people say, well, I got too old to do this? Is it more a function of I stopped doing it as I got older, not because I got too old, then I stopped doing it? Is this where we start to see some of that conversation come in?
Absolutely. So sometimes you stop doing things because you feel pain, and you've been given poor advice to just rest, or as you're getting older, you're doing less and less, and then the pain starts creeping in more.
We've talked about that.
That's more common, the latter,
okay,
where you're doing less and less, and then you start feeling the discomfort in your joints, your back, because you're getting that muscle atrophy.
How do you see that avoidance disguises itself as something smart or something careful?
Well, it's kind of it's common sense to a lot of people that, they have back pain. We'll stick with that. Their back hurts when they move, they bend, so they pull that back. They retract that movement, or they went to their initial physician or an urgent care and they said, well, just let it rest. They don't really give a guidance of how long to rest. So the fascinating thing is I talked about kind of that normal loss of muscle mass as we get older, over age 40, but people that are more bedridden or couch ridden that aren't moving, that can be up to 3 to 9% muscle mass in just a month.
Oh,
so
wow.
Up to a month of just sitting on the couch or laying in bed, you can get up to 9% muscle loss. And then you times that by 2, that's a lot of loss of strength.
Yeah.
And so when we see people that, let's say they had a pneumonia, they go to the hospital, they need to be ventilated. Well, we are getting better. University of Pittsburgh has done a really good initial job with this, of getting people on supplemental O2 or on even ventilators up and walking in the ICU. That's so crucial because you're moving. So you're not bedridden. You're not going to get that same deconditioning or loss of strength and muscle mass.
This is the same thing where if I'm more fit going into a surgery, I will probably have a better outcome.
Absolutely.
It's a welcomed or an invited injury that I can recover more quickly from if I'm fit going in.
Yeah. So an interesting thing for me is I do a lot of injections for back pain too. And if I see an older patient that is so atrophied in their muscle tissue and I do an epidural injection, that's putting numbing medication steroid in the spine to help with alleviate pain going down the legs, that radicular or sciatic type pain. But that nerve that sends the pain also controls motor function. So patients that don't have any stability or have lost so much muscle in their glutes, their thighs, when I do that injection, I know they're going to go back to the recovery room in a wheelchair because their legs are going to be so wobbly. But patients that have more muscle strength can compensate for that and just walk back to the room.
Is this also why a lot of times I work with athletes who I just got injections and you'll send them and it's like, this is the time to get fitness in?
100% because they're feeling better.
Okay.
So that's the only reason I really do injections. The injections aren't the cure, it's to quiet it down so because they're hopefully going to feel better and then we get them strengthening. Because that's the cure.
What are the physical capacities that are related to the strength or muscle mass loss that you see a lot with your patients that come in? And I'm assuming that a lot of the patients aren't working out. Is that correct?
Yeah.
Okay.
Most.
So most of the patients, I always want to say athlete, that you see is not working out. What's the first things or that you notice that they don't do or can't do anymore?
They have trouble just standing up.
Just
their balance,
squatting.
They can't squat. They have trouble going up and down stairs. Are probably 2 most common things.
And they will avoid these things.
Yeah, absolutely.
So
they'll move to a 1-floor apartment or house where everything's on the first floor, so they don't ever have to do stairs.
This is when you see the person that doesn't go to the University of Tennessee football game because those stairs are treacherous. They can't actually go down.
They can't even walk from the parking lot to the game.
Wow.
So when you have that pain in the back, walking can just make it difficult.
We're not even talking about deadlifting. We're talking about you're not even walking into the place to have fun to begin with.
So how much is that going to affect your quality of life? And that's what I try to push home is we just want to get you functioning so you can do the things you enjoy, because that is so much fulfillment as we get older, going to your grandkids' games or whatever it is you want to go see. If you're confined to the house, I mean, just mentally that wears you down so much. And then if you're sitting, your lungs aren't expanding, you're not getting as good a heart function, you develop swelling in the legs, around the heart, so you get heart disease, congestive heart failure. It's just so compounding.
So you talked about how quickly we can lose, without doing anything, how quickly we can lose muscle mass. You talked about how quickly we can lose strength on top of that. Is there a certain age when that does start to compound? So if I'm 20 and I do nothing, it looks like
40.
eggs. Okay. 40 is like that.
40 kind of seems to be that cutoff where, one, it starts getting harder to build muscle because our body, especially if you haven't been training up until 40, that other factors in our body with hormonal changes, vascular flow, protein intake, you're not consuming as much of those things, or even if you are consuming the same as 40 as 20, your body can't utilize it as well. So you have to get more protein in. You have to do a little bit more exercise to overcome those other areas of your body that are starting to get older and degenerate too. So it gets 40 is, for most of the things we've looked at, seems to be that cutoff. Now, and it just gets worse. 60 and 70, it's even that much harder.
This is my testosterone starts to go down, estrogen changes, so contractile potential is different. All of these things start to kind of fall off the cliff. And then I noticed that in things like at the gym, what would I see change when if I'm working out at that time? Will I notice that if I'm working out during it?
Yeah, you're going to notice, really, it's pretty simple, that let's say you're someone that has always worked out. And as you get older, you're just not seeing the gains that you used to see. So
the same amount of time gives me less of a result.
Yes.
Okay, got it.
But those people that have been working out, you can change some things physiologically within your body. It's called muscle protein synthesis. You can kind of adapt, so you keep building muscle.
And this would be changing the workout programming, I'm assuming. So I would more relate it to my age and my life, all of the things that are going on outside versus what I could have done 20 years ago or being in high school. This is what I can do today.
Yeah, and the good thing is you can change it. Or if you're the opposite of what I just described, you're someone that's never worked out, but you're 50, you're starting to get back pain. You see me, we've noticed that you have muscle atrophy around your spine. We'll stick with that. We can build that back up. But we may have to change your protein intake. As you get older, if you had 20 grams of protein per meal, if you haven't been very active, your liver it's that first pass metabolism isn't processing the protein as well, so you don't get as much in the bloodstream for the blood cells to take up.
If I'm a patient and I'm coming to you and I'm 50 years old and I haven't been working out and I say, okay, this is what I'm changing. I've started the new year. What would be a protein goal that you would give me? What would be, not arbitrary, but what would be my starting point?
I always say you want to shoot for 100, so at least 30 grams a meal.
Okay, got it. 100 grams per day.
Yeah.
Okay, got it.
And that's obviously, I'm just pitching out a number to make things simple. It's based on body weight and
but
stuff
this
like
is
that.
probably a lot more than what they were already getting.
Absolutely.
Okay, got it.
And they have to, yes, you need to get that protein, but then they'll often say, well, I exercise, I walk. That just isn't enough. Right. Walking is exercise, though I often think that's not the exercise I'm talking about. That's good aerobically, but to build muscle, you're not going to build muscle that way.
And we know aerobic exercise does kind of turn the volume down on pain a little bit.
Yeah,
but it's definitely not going to be like a resistance training.
Right, and it's not going to help prevent that age-related loss of muscle that we want to see.
That was my next question, actually. So if, what do you see today? I'm not sure how you feel about this, but you go get the elective MRI just to see what's going on. We don't even have to jump into that unless you really want to, but a lot of people say I'm 40, but I look like a 35-year-old on the inside. Like you hear a lot of that today. Does avoidance accelerate aging?
Oh, 100%.
Okay, so if I'm 40 and I'm not doing anything, I'll come back and be like, man, I'm 50 on the inside.
And that's a big thing in health right now, is looking at longevity. You see all these people, if you're online, talking about longevity, living forever, don't die. That's all good. I'm happy with dying, but I just want to live while I'm here to do everything I want to do. So if you're avoiding things, you're going to age a lot faster. Okay. Because if you're avoiding things, one, you're going to get decreased blood flow. So you're going to have decreased, health to your muscle tissue and all your organs. Mm-hmm. I think skeletal muscle is so crucial for longevity and health in general and maintaining function. I think it's one of the biggest things we're starting to focus more on, but hasn't really been a focus as an organ to preserve as we get older. And it's so crucial. The benefits of healthy skeletal muscle tissue, as we've just alluded to, just with functionality, balance, being able to move and decreasing pain, but also the host of benefits, decreasing inflammation if your skeletal muscle is healthy. If you're exercising and building that skeletal muscle, you're going to have better vasculature, you're going to get better blood flow. You're going to get that, as I just mentioned, that decreased cytokines or inflammation. You're going to have decreased insulin resistance, so you're going to have better, blood sugar control, less fat tissue buildup. insulin resistance, we always think of it as geared towards fat, but insulin resistance also affects how healthy your muscle is too. So if you're starting to get insulin resistance, that through the pathway of insulin growth factor, you're going to get decreased muscle building as well.
And then eventually could be talk about dementia.
Absolutely.
Like
so
in the presence of too much
100%.
sugar.
If you're exercising, there's brain-derived neutrophilic growth factor.
Yep, BDFN.
So if you're exercising, that helps with neuronal pathways, grow new neuronal pathways in the brain. You're definitely going to decrease dementia symptoms.
Yeah, and that's from just exercising regularly.
100%.
And we've talked about this before. I think that is the WHO, is that 2 resistance sessions at 40 minutes?
Yeah, I think
Is that what they're at? We usually
2 or
recommend something
45
close
or
to
something.
4.
If at the very least, and I think Dusty would say at very least 3, but I think at a minimum, and this is usually what I tell my patients, give me 2, especially if they've never done anything and they're still working, give me 2 days a week of 30 minutes where you're doing some strength training. And let's start there.
Yeah. What's interesting, I think that as we talk about this, we build these people in our minds, and I see like the athlete who got busy, who wasn't intentionally avoiding anything per se, but then they may have made the case in their mind like, oh, this could be dangerous. And then something happens where there's a disc disorder, they have some sort of a bulge or whatever it may be, whatever you see the most of, and they weren't doing anything. They weren't active.
Yeah.
They weren't, where a lot of people might come and say, oh, I tried to deadlift 800 pounds, whatever it may be. There's the bulk of what I imagine that you see are people that have not been doing things like that. And in fact, it kind of goes with the recent statistic. I'm pretty sure that I read one that says the inciting incident, there's 70% of all back injuries, there's not even an inciting incident.
Yeah.
You don't even know what happened.
It's even higher than that.
Okay.
It's rarely is there something that causes the back. It's just that slow buildup in the background. And then one day you get out of bed and you get shooting pain down the leg because the nerve's getting irritated. And I kind of will go through that a lot. And the biggest thing I point out, and it's virtually universal, is the loss of muscle strength, those posterior chain paraspinal muscles in the back. Those are so crucial to stabilize your spine. And it stabilizes everything. And, I talk about how people lose that ability not only just to walk, but to go up and down stairs, get up from a chair. And those back muscles, glute muscles, we've talked about that, my favorite, flat butt syndrome.
That's right.
As you lose those glutes, you're not going to be able to stand up. You're not going to be able to go up downstairs. And it's because you're losing that stability in that trunk.
Yeah.
So really focusing on everyone. The universal word in this world when I say back pain is strengthen your core. And people don't really know what the core is. Most people think I just need to do more sit-ups. I usually say you need to strengthen from your elbows to your knees, that trunk of your body. So there's no magic exercise. We talk about deadlift, squats, because those all are strengthening multiple muscles, but focusing on those quads, hamstring, glutes, and back muscles, you're going to do so much better long term.
How much of the avoidance comes from a history, and then how do you overcome that? So I'm the person who maybe I did try something. One time I tried to exercise, and then I was like, oh man, that's just nothing. How much does that have to play in with what you see? And then how would you overcome that if I was like, man, there's no way I'm going to go deadlift. Like that's the worst thing I've ever heard to do.
Well, what I do is I have them they say I can't do a squat because I have knee pain or I can't load my spine. I hear that a ton, is I shouldn't load my spine. Well, then I have them stand up from the chair and I said, we just did a squat. You can do it. And we can start to add weight to that too. Or with the deadlift, I say, well, can you, bend to your toes? Let me see you reach for your toes. And I said, well, we just did the deadlift.
Yeah.
So showing them that they can do it, nothing bad's happening. And obviously they're not going to add a ton of weight right away, but just doing that hinge movement. And then I explained to them that slowly we'll have you work with someone to help progress with that.
Yeah.
Because you need to bend at the waist, as we've talked about a lot.
To hear you say that, though, I can just picture myself being the patient, and to hear the appeal to authority that somebody like you has, that's finally checking the box. Like, hey man, you just did squat.
Yeah.
We're probably not going to send you to somebody that's going to load you up and put a 400-pound barbell on your back tomorrow, but you can start somewhere.
Yeah.
And that's a big deal.
And I just explained that is a functional movement that you're doing every day anyway. So whoever told you not to bend at the waist, not to squat, you just maybe need to rethink who you're listening to.
That's right.
So yes, a lot of it's patient's history where they were at the gym, they hurt their back squatting. But that doesn't mean you can never go back to it. Maybe your form was wrong. Maybe you were off for the holidays and then you went back to squat a big weight.
Super common. Yep. Yep. Very common.
So a host of things. Or maybe your brother had a back injury and he said it was from squats, so you're fearful of squats. Family is a big component of what drives chronic pain. So much it's out of love. So, I may see a daughter come in with her 70-year-old mom and she's babying her mom. Mom, I'll get you this, I'll get you that. You just sit on the couch, not intentionally realizing that's going to make her pain linger, but just trying to be loving instead of encouraging her. Well, come with me, let's go walk to the mailbox together. That feedback that we get, I see from patients' family members. I had a woman the other day, super sweet lady, and her husband was with her, and she couldn't even walk down the hall. He was holding her. She was leaning on her. She couldn't get up to the bed for me to examine her. He was just doing everything. And so I just had her come and not her, they were coming together, but when I was examining her, just her, I had her bend. I had her stand up from the bed. Just little things. As we can start doing this more and more, and that's what's going to really help, one, improve the mobility and help decrease nervous system sensitization, but also really gives her that empowerment that she can do some of this stuff.
Yeah.
She walked out of the office. I did nothing. She walked out of the office on her own just because she said, well, I'm really encouraged. I finally have hope. And it's that hope that so many people, when they leave the office, feel like, I was told this MRI, I need an injection or surgery. This is a chronic condition. I'm going downhill. And when they feel that way leaving the office, you've lost them. But if they can leave the office, even doing nothing, but give them that encouragement that they can start doing more, it's just so powerful. It's amazing.
I think a lot of professionals would do well to hear that. Doctors, coaches, that you confronted the problem, but you confronted it in such a way by showing the athlete, patient what they could do.
Yeah, and you gotta take the time, and none of this takes much time, and especially in healthcare today, where as physicians you're so strapped for time because overhead's so high. Insurance pays less.
Yeah,
you just gotta pump and grind. So patients, physicians will come in with the MRI, tell them what it is. This is the treatment. Little education is given, and like I said, they often just leave thinking they're doomed. But if you can just take a little bit to not just read the MRI report, but show them a little bit on that MRI, you're just educating them on what's really going on, why it's happening, and how you can repair that.
And it's really easy to picture the loving husband who's hand in hand with the wife walking into the office, but to imagine if you just walk that out, the freedom that she's lost elsewhere.
Oh, absolutely.
What can she not do for herself?
Well,
what
they
is
had
she
3 little kids,
today?
and she can't take care of them. She can't cook meals, and male or female, you find fulfillment in taking care of your family. And 100%. If you've lost that, you're just going to get depressed. You're going to be sad over that, and then if you can't get to work, you're going to lose that independence that you can provide for yourself and your family. So helping them regain that by doing exactly what we're talking about, avoiding avoidance, is just, and giving them that the encouragement that they're going to get back to that is so important. But I think what I love about this topic is this is where healthcare needs to start at an early age. It has to be, so much of it is read and react and symptom management. We're treating diseases and symptoms of disease. We're not treating health. So if we can educate patients and clinicians on focusing more on keeping people healthy versus treating the problem when it comes up, it's just going to be profound, the impact.
Now, if I was coaching an athlete who just went from like you were talking about, they took 3 weeks off, they had a vacation, they had a holiday, then they came back in and they jumped into training even more than what they were, and all of a sudden they're hot, their knees are on fire. I'm obviously going to calm that movement down. That may be a case to justify not squatting temporarily, or to do something that may look squat adjacent, but not put them in more of a provocative measure. Now, in that same instance, what would be a justified medical reason for avoiding something? Is there a justified medical reason for avoiding, not a necessary movement, but maybe avoiding exercise? What do you got?
Let's say you come in and you have a huge disc herniation pressing against the nerve, causing severe pain down the leg. And anytime you hinge, that narrows that space where the nerve is traveling through from that disc protrusion or herniation. I'm going to tell them, let's avoid doing any deadlifts right now.
Okay.
Let's avoid, loading forward. I still want them to start working on that because they're doing it anyway.
Sure.
They're hinging when they sit down.
Sure.
So I'm still having them work through the mobility side of things, but avoiding any loading.
So this would be a time where, in that instance, I'm not going to hinge. Maybe I'm going to. It could, depending on how lit up they are, and depending on what their conditioning is at the current time. It may be something like, can we walk? It may be something like, can we carry? It may be something like, can we push a sled? Can we pull a sled? It may be something like, can we squat? Can we step up? Can we do that in any number of variations? But things like that is what you would recommend, as opposed to we're going to hinge, we're going to deadlift, we're going to RDL.
Right.
Okay.
Exactly. And opposed to saying just lay in bed for a week, because we just talked about how just a week is going to cause that loss of muscle mass and strength. So we want to keep them moving, but yes, avoiding certain movements. Some patients come in, have a compression fracture in the vertebrae, the bones in their spine. Hinging bothers it. We're going to avoid doing a lot of bending and lifting right now.
Temporarily.
Let that bone heal, but you still have to load the bone because that's how bone heals quicker. So,
and we know that loading bone to bone would actually be jumping is fantastic for actually improving bone density, but so is weightlifting.
Right.
But like you said, I'm maybe not going to hinge right now, and I'm maybe not be jumping right now. If I have a compressive disorder, I'm probably not going to jump right now.
In the past, they would tell you to avoid any movement. They'd put you in a back brace if it's the back and tell you just to rest for a month or 6 weeks because bone heals in 4 to 6 weeks. But we know we can expedite that if we start loading that bone. So maybe it's just a carry, as we've talked about. Maybe it's just walking, because when you're walking, you have to strengthen those core muscles and the back muscles. So that's going to pull on the bone, and that causes bone turnover. The bone cells start getting activated, the osteoblasts, so you build more bone quicker. So
what was the result of that 4 to 6 weeks of being wrapped up and doing nothing when you got out of that?
Well, up to 9% loss of muscle mass, as we talked about. So if you're
if
not
you were
using
already
a muscle,
on the wrong side of that,
it just makes it that much worse and harder to recover. Yeah, your bone's going to heal, but functionally, what is that doing for you? And that's the whole goal. We're not just, I don't like treating pain. I like treating function. So I'm going to help you get out of pain, but I'm going to maximize what you can do from a functional standpoint. And that's really the goal, because that's how you enjoy yourself.
That's right. Now, flip side of that, I come to you, I'm 50 years old, I've never done anything, I'm in pain, I don't want to be in pain anymore. I say I am in for 100% of whatever you tell me. Based on that, how much room could I make up? How much could I gain in a year?
That's a good question. I don't know percentage-wise, but you're going to gain a ton.
Okay.
You're really going to notice the improvement, and it's going to be quick. If you haven't done much and you're all in, you're going to see so much improvement in just a couple visits with a trainer like you. Or
that first year's a honeymoon.
Therapy.
Everything's great.
I mean, that first year, you're going to feel like you're a new person.
That's right, 100%.
It's just fascinating what their eyes open up and what they can do. And the cool thing is that doesn't stop after a year. Yeah, you may not see as much change because you're going from 0 to 5 feels a lot better than 5 to 7 in like a functionality standpoint. Sure. But you're still going to keep getting those gains. But when you go from nothing to something, that just is amazing.
Yeah.
I love seeing, especially for whatever reason, it's older people when they're, can't leave the house, they're stuck at home because their back's bothering them. And when they're able to go out or go on a vacation, I had a woman, she was like 68 or something a couple weeks ago, and all she wanted to do was go to Europe in November. And I saw her, I think, in August. And I said, well, we're going to get you there. So we did do an injection on her just into her joints of the back where she had some arthritic change, and got her working with a good physical therapist who started implementing what we've talked about, just functional strengthening for her legs, her back, her hips. And she was in Europe for 20 days, and she said it was one of the best experiences of her life. She walked all over. She was carrying the suitcase. They were on like a bus tour. She was just stunned, and her daughter and family who was with her just couldn't believe she could hang.
That's like what you're talking about.
And that's just the most fulfillment I get as a physician.
We don't. Some of us do, but most of us don't deadlift to deadlift. We deadlift because of the things that we want deadlifts to lead to.
Exactly.
Okay.
And that's why we harp on things like deadlifts, squats, carries, because you're doing that all the time. So we're just training the body to keep up with the things you want to do.
That's right.
And if you're not doing those things, well, no wonder why you can't go upstairs anymore. You haven't trained your body to do that. If you want to be a pitcher, you have to train your body to withstand throwing it. You keep practice throwing strikes. That applies to everything in life.
That's true. Yep. Now, how much do certain phrases that you've seen doctors throw out, not to speak just to doctors,
Yeah.
because coaches do it, and I cringe at it when they say things like, you need to protect your back, or you need to do this. How much does that affect the patient or the athlete that's in front of you?
It's a scare tactic.
Okay.
They get scared. Any words like that induce that fear, which we've talked about, that fear avoidance. So when you start, I almost never mention pain. I never mention, a needle if I'm doing injections. I try to focus on the encouraging side of things, because words like that are where, protect your back. How do you protect your back? Like, what does that mean? I think a couple of podcasts ago, I did use that term and Dusty called me out on it, but it's so true. What does that mean, protect your back? So I don't use it. So then you get fearful. Well, he told me to protect my back. I shouldn't use my back muscles. I shouldn't lift or things like that. So you got to be patients miss a lot of what you say, but they pick up on things they want to hear. And it's often the negative things that you don't mean anything negative by it, but they're getting fearful because you said something like that. So if you just say, a lot of times when I have spine patients, they have a disc herniation causing narrowing. And physicians still to this day often say, well, if this worse, you could become paralyzed. Now, that is the most terrifying thing in the world.
That's called hanging crepe,
for
right?
someone.
Isn't that what that's called?
I
You're
don't
pointing
know,
to the
but
worst
it's called
thing
scared
ever?
as shit by the patient.
That's right, 100%.
Because then you don't want to do anything. Because this could cause me to, and I always I would never say that, but try to back them off that, that fence where say, no, you're not, this will progress, but your nerves are extremely adaptable to this narrowing or stenosis in your spine. And we just got to strengthen around it and stabilize, keep you mobile. And this will never get to that point.
How do you tell an athlete? How do you give them a directive if they're in pain when they see you? How do we differentiate between respecting pain or obeying fear? Like, what do we do to be like, oh no, this was cool, that was the right choice, versus no, you probably should push through that.
Yeah, and that just comes with initially when people get, and sometimes backs can be. It gets 10 out of 10 pain. A lot of women say it's worse than pregnancy when they get a pinched nerve. So it is real. And that's the time to back off, where they should be a little fearful because if they haven't seen anyone yet, they're just miserable. Their leg feels like they can't walk on it. It's scary. So I like to see them as quick as possible with that and just reassure them. If neurologically everything's okay, their nerves are firing appropriately, it's just that nerve getting irritated. So we got to quiet it back down.
Okay.
And a lot of times, if it was from stenosis that's causing it, that stenosis didn't happen overnight in the next morning when they got out of bed, causing that pain, sciatic pain down the leg. But for whatever reason, that nerve started getting irritated. So just explaining that to them and say, you've been living with this for a long time. We can get this nerve to quiet back down. Or if it's a new disc herniation, let's say it is someone that came in from the gym, was deadlifting a ton, got a huge disc herniation. Still, rarely does that require surgery, but if we treat that nervous system, we can get that nerve to quiet down. So it's just
surgery is less than 5%. Is that
in my patients? It's less than 1%.
Okay.
So it's rare.
My gauge on this, and I've talked to you about this a lot of times, where how we'll do it is, again, depending on the person, depending on the situation, you have to read it and see where they're at. If it's a deconditioned athlete for 30 years, never done anything, you're going to treat it very different than the athlete who's deadlifting regularly. Yeah, you're going to speak to those people even differently because their concept of what fitness is even different.
Right. But those people recover so much.
The person that's been doing
it.
Yeah, that's right. Now, when you have those, it's kind of like poking the bear a little bit. You come in, first off, in my opinion, tell me if I'm wrong, it would be silly to be like, hey, we're not going to be in pain while you're working out, because there's a good chance that you walked in here in pain.
Yeah.
So that in and of itself makes that wrong. That statement is already sort of strange. But there's what I would like to see, that whatever we do touches into the specific spot that we're going for. We're not avoiding it.
Right.
We're trying to make it better, and making it better, stronger, faster, whatever it may be, requires some kind of adaptation that probably feels slightly uncomfortable. But within about 24 hours, I've returned to baseline. Would you say that that's an effective way to train through that, or that's a decent goal, or that's a good measure?
Yeah, absolutely. And so I usually just work, if you have mild or moderate discomfort while you're moving, it's okay. Especially if that pain comes afterwards, which most people that are deconditioned or haven't been really training for a long time, you're going to be sore afterwards.
100%.
Usually they'll describe it as a different type of pain because it's muscle pain. It's soreness in their muscles that they haven't been using. But I also do say, but if you get severe pain and it's 8 out of 10 and it's during let's say a squat when you're doing it, we know we have to back down.
That's right.
We have to modify. We can still strengthen your glutes and your legs, but we're not ready for the squat. So we're just going to do something else to train those muscles, those accessory muscles, and build it up. And then we'll get you back to the squat.
What's one thing I can do right now to start approaching feeling better as opposed to avoiding fitness?
If you haven't been doing anything?
If you haven't been doing anything.
Ooh, that's a good question. I always start with the sit to stand chair squat.
Okay.
I say, let's just get you sitting to standing, especially with anyone, but with older patients, because that's so necessary in life to train those legs and those glutes, because that's going to help you get upstairs. But we want to be able to sit to stand. That's always my go-to with patients, because they can all do it because they're doing it sitting in the chair with me, so I know they're in there.
So, yeah.
But even patients that are so deconditioned they come in a wheelchair, or so much pain they're in a wheelchair, I'll just have them do that and just stand. Let's just do some standing.
Yeah.
Because you got to activate your muscles to stand up. So that's usually where I'll start.
Start squatting, stop avoiding. Doctor, thank you for your time.
That was a good one.
Thank you for watching. Join us for much more where that came from. And when you get a chance, follow us on Instagram and YouTube at Back in Action Podcast.